Hi, I'm Dr. Thomas Pawlowski, Family Practice Department, UChicago Medicine, Crown Point. Today we're going to talk about common respiratory illnesses we see in the clinic in the fall and winter months. These will include common cold, influenza, COVID, and RSV virus. The common cold is most likely what we'll see. These are most likely going to be taken care of on their own with time and usually with over-the-counter medicines. Influenza is the flu virus and can be much more dangerous to people, particularly to the very young and very old. Influenza will usually result in more severe symptoms. These include fever, chills, body aches, and shortness of breath. These symptoms can be treated. Where the normal cold usually will just resolve on its own, we have prescription medicines to help. So identifying influenza is very important in the practice. This can be done with rapid PCR testing that's done through our emergency room, urgent cares, or even in the office. RSV is another virus that we see increases in the fall and winter months. RSV stands for respiratory syncytial virus. Usually seen in the pediatric population, it can also affect the elderly population as well. There is no antiviral choice for RSV, but supportive therapy can definitely help. The coronavirus 2025 is different than what we saw in the past and presents differently. Where before it was mostly flu-like conditions, it may present in different forms. The best thing to do if you're worried about COVID infection is to get tested. Whether it's over the counter at a local pharmacy or at an emergency room or urgent care, it's very important to test and see if you have the active virus. COVID has specific antiviral treatment. Paxlovid is commonly prescribed for this in certain populations again. With all these respiratory illnesses, the question comes up, when should I go see my doctor? First, if symptoms persist past 5 to 7 days without improvement, that would be one reason to go in. Second, if you have fever that is unrelenting, meaning that it doesn't get better with Tylenol and Motrin, stays higher than 102 degrees, you should also see attention. Respiratory problems are always a concern with these illnesses, and if you feel that you're shortness of breath or your child is short of breath, that should be seen immediately in the emergency department.